Hello, my name is Evelyn Rubalcaba, and for my interview presentation, I decided to interview my um, therapist, Joseph Dodd. He is a licensed counselor and director of behavioral health over at Regents Health Network. He has a master's degree in psychology and has had his own practice for about 11 years. Um, so the reason why I decided to interview Joseph out of all people was because of the connection that we've shared, that he and I have shared. I remember I started seeing him back in 2023 when we're experiencing some heavy anxiety, and honestly I just feel like there's that a little bit of level of trust to where I wouldn't feel so awkward when it came to the interview process and asking him certain questions in regards to his healthcare profession. And if anything, his healthcare profession to me is kind of interesting just because in the conversations that we had, I now have a new level of respect for those who work in behavioral health and who deal with patients who have severe mental illnesses. And so, yeah, let's dive in. So, there were a couple of questions that I asked, but I was able to narrow it down to some specific moments that really stuck with me or stuck with me throughout the process. One of the first thought-provoking questions that I asked of him was, can you share a moment from your counseling practice or any sessions that you had profoundly changed your understanding of mental health or client interactions? And his response was, I remember working with a patient who had pretty severe mental illness, such as schizophrenia, and I remember spending a lot of time thinking, how can I use cognitive or psychodynamic kind of approaches to help this person? And I was having trouble. That I went to one of my old professors, and he told me, depending on which disorder and things that you are working on, the outlook is different. The outcome we're looking for is different. So in this case, the quality of life improvement, and sometimes things like this can look different. And that struck me because in reality, with every situation being different, every um, person being different in their own reality, um, a quality life improvement he mentioned could be something as simple as getting into stable housing or even maintaining their own relationships with their loved ones or friends or family members. And so that to me really struck with me because it kind of motivated me to celebrate like small victories, say in like my own personal journey, mental health journey. And I feel like we can really benefit of that since we are dealing with college and our own educational journeys, if you will. The next question that I asked was that, in what ways does he advocate for his clients within the medical system, ensuring that their mental health needs are prioritized along with their physical health? And as I mentioned before, Regents Health Network is both a medical clinic and a dental clinic, and their focus is to provide affordable health care to low income families. And Joseph really mentioned that he uses that to his favor because he has a personal connection with those on staff, both nurses and in the dental side of things of the clinic as well. And so he not only this is what he says. When I have a patient who may be struggling with something that may be felt unheard by providers, I say, hey, can I have your permission to advocate a little bit on your behalf to talk to the provider? Not only that, but he purposely practices with his patients on how they will communicate so that they can advocate themselves so they can have a sense of autonomy. And really, I just thought that was really impactful, just because it's one thing to advocate for the person, but it's another thing to teach them through it. And I feel like that's something that we need to be taught more, is that you can advocate for yourself, that you are not just needing to listen to what your doctor says, that you can have questions, you can ask for certain things. And that's one of the things that have been that really impacted me when it came to asking that question. Another thing that I moved on to that really resonated with me was in this question that I asked, what self-care practices do you like to engage to maintain your own well-being and prevent burnout? And he said that secondary trauma is a real thing, and the best way that he could put it is that it's like secondhand smoking, where really heavy information tend to chip at your own emotional well-being. And so more than ever, he was having that when it came to, say, COVID times, and he had to really lean on to emotional support groups and community groups that were made of licensed counselors, just basically to talk about what's been going on, how can we continue to keep a stable mind in the midst of all this chaos. And one thing that he said that really stuck with me was that, from a mentor of his, said that at the end of a day of lots of clients, heavy subjects and whatnot, he had a hat hung on the wall. And what he would do is that he would take this hat and he would put it on his head every day before he left the office, and he would think of all his worries and would ask himself, did I do an adequate job? Not a horrible job, not a perfect job, but an adequate job. And just thought about everything that happened in that day. And if he could answer himself yes, then he would put the hat back on the rack, and he was able to leave it there at the office and allow for that negative, or that, I guess, those negative emotions or those worries to stay in the office. And I feel like in many ways we do need symbolic gestures like those. And if anything, I think I might involve a little bit of a ritual myself when it comes to what's the word? When it comes to, especially dealing with grades, dealing with work, dealing with life in general. And I just thought it was really cool how he mentioned that. Another thing that was out of the blue that really struck with me is the age group in which he sees in patients. The youngest person that he sees is a 4-year-old, and the oldest person that he sees is an 88-year-old. And so this stuck with me just because I can't believe a little kid can be experiencing so much at such a young age, and honestly, for an older adult to still be dealing with so much at such a late stage in their life. But it's just one of those things that just really is an eye-opener. In conclusion, I feel like I was able to learn a lot and gain a better insight to those who work in mental illness fields. And as I mentioned, I was able to gain a whole new level of respect for them, to be able to meet the needs of many age groups and truly applying that symbolic gesture. And honestly, I think I might be applying that symbolic gesture of taking off the hat every time and leaving something where it was, so I don't stress about it as much. But either way, I was truly honored to have been able to interview Joseph, and I hope you guys have found this information as interesting as I did, because it was truly, really a fun experience. Thank you.